Welcome. I'm Michele DiStefano, Director of the Shelley and Stephen Einhorn Audiology Center at the Center for Hearing and Communication. In celebration of the 30th International Noise Awareness Day, CHC is proud to present a conversation with Dr. Richard Neitzel, Professor, Environmental Health Sciences, Professor of Global Public Health, and Director of the Center of Occupational Health and Safety Engineering at the University of Michigan. Dr. Neitzel is an exposure scientist whose research focuses on the effects of exposure to noise, heavy metals, and other ototoxins, psychosocial stressors, and injury risk factors on health at the University of Michigan's Exposure Research Lab. He served as the principal investigator for the Apple Hearing Study, a groundbreaking collaboration with Apple and the World Health Organization using real-world data to examine how sound exposure impacts hearing and health. Welcome, Dr. Neitzel.
Thank you so much for having me.
So let's start with our first question. Can you give us an overview of your work in the Apple Hearing Study and your broader research into occupational and environmental noise exposure?
Absolutely happy to. And I will say it's a monumental achievement to be celebrating the 30th anniversary of this important event. I am a huge fan, as you might guess, of any event or activity that raises the profile and awareness of noise to the public and especially to the healthcare community. I think both these communities historically have treated noise as a lesser pollutant, one that might not be as harmful for us as air pollution or water pollution or food contamination. And the research that we've done in my lab, as well as hundreds of other researchers around the world, have basically demonstrated that it is just as bad for us as those other exposures. So diving a bit into the Apple Hearing Study, this is a study that launched in November 2019, and it's ongoing. We have over 180,000 participants at this point who are spread across all 50 states and all of our US territories. This is an incredibly exciting opportunity for an academic like me to partner with an industry entity, especially Apple in this case, in that we can bring interesting scientific questions, and Apple has the technological know-how and wherewithal to actually implement some things that can make understanding noise exposures, for instance, possible in ways that simply never were historically due to technological limitations. So in this study and across these more than 100,000 people that are participating, we've had an opportunity to start to evaluate things like how much sound are people exposed to on a daily basis from their general environment? How much sound, in addition to that general environmental sound, are people getting through their headphones, for instance, listening to media, music, podcasts, etc.? And how are people's hearing levels potentially associated with these exposures that they're having? So for the first time, we've got something that Apple has created, and we're validating here at the University of Michigan, an app, actually a set of apps that are actually able to test people's hearing remotely in the absence of an audiologist, and to do so in a fashion that gives us reliable data. So we're in a great spot here, having all this data, starting to be able to pick apart trends in noise exposures, trying to identify groups that have more exposure than other groups, looking at differences by age, differences by location. And just to give you a quick preview of maybe some of those concepts, we found out that about 1 out of every 3 Americans who are participating in our study are exposed above the safe level for preventing hearing loss, which is a 70 decibel average level as a 24-hour average, essentially a daily exposure, recognizing that people might have some louder exposures and we need to have some quieter exposures to bring that average down to 70. And 70 decibels is probably just a little bit louder than people are listening to this video as a way of sort of calibration. So 1 out of 3 people are getting too much sound from the environment. We found that about 1 out of 5 are getting too much sound from their headphone listening. We found that there is a strong gradient in exposures between younger folks. Our youngest participants from 18 to 24 have much higher exposures than other groups, and our our oldest or more experienced age group in this study, which is more than 65 years old, has by far the quietest sound levels. We're seeing differences by region. We're seeing differences between urban and rural environments. We saw a tremendous reduction in noise exposures across the COVID-19 pandemic lockdowns. So we're doing things and evaluating data in a way, as I said, that simply has not been possible previously. And I feel so fortunate to be able to share this with you.
That's amazing. I think it's just one of the things that we really try to do is make sure that there is awareness in the public. And so even knowing that there's 1 in 3 people that are exposed to louder noise than they should be is a startling new statistic. And are there any things in particular that you typically recommend for people to use, whether it would be some new apps or technology that's coming out, or even devices that they can use at this time?
Yeah, I will say I feel incredibly fortunate that we, the public consumers, have access to so much more technology and so many more devices to help us understand exposure today than we did even 5 or 10 years ago. So, just to give you a list, of course, working on the Apple hearing study, I'm very familiar with Apple's products. And so, for instance, if you have an Apple Watch, there's a noise app on the watch which performs just about as well as an off the shelf commercial sound measurement device. And so you can use your watch to essentially evaluate how loud is this environment? Is it potentially harmful to your hearing? And the watch will even alarm and activate to let you know, hey, this sound level is excessive. You should really think about either leaving this environment or maybe protecting your hearing. So that's an example of a wearable device. I've been working with the World Health Organization for going on 8 years now on a campaign they call Make Listening Safe, which is a global campaign designed to essentially raise awareness about the potential risks of listening through headphones. And as part of that group, that consortium that the WHO has put together, there's now an agreed upon standard for phone manufacturers and smart device manufacturers to design their devices specifically to evaluate people's exposures to sound. So, for instance, you can open up an iPhone and you can go to the health app and you can see in there your estimated exposure to sound from listening to headphones over the course of a week or a longer period. Likewise, if you go into the health app, you can see noise levels from your watch. So the thing that's really exciting about this is no longer as a consumer or a member of the public, do you just have to say, how many decibels is that? I have literally no idea. You can help kind of calibrate yourself to your own exposures and understand when those exposures might be creeping up to an unsafe level. And ideally then modify your behavior to make sure that you're staying at a safe level. Again, I don't want to suggest that I'm indicating people shouldn't listen to headphones or shouldn't do fun events. I just want them to use the information available to make sure that they're doing so in a safe way. This is an example of now an agreed upon standard where phones can help measure our sound and wearable devices that are out there. These are all great new developments. One final thing I'll mention, the National Institute for Occupational Safety and Health, or NIOSH, has developed a sound level meter app that can be used on phones. And so even if you don't have an Apple Watch, you can still use this app on an iPhone to sense the noise levels around you. So I think this is very empowering for members of the public, consumers, where we can, instead of living in kind of an information vacuum, actually educate ourselves. Well, how loud is that? And if it's too loud, I need to think about how I can make sure my hearing is safe.
Absolutely. We've seen even at our center that some parents are downloading that app so that they can actually advise their children if their environments are no for protecting their children's hearing as well, or limiting headphone output sometimes through their devices and their smartphones. So it's actually quite an exciting time since we actually have some information and some ways to target that. So also at CHC, we work with many individuals who are experiencing tinnitus, and we offer tinnitus retraining therapy as part of our care. Can you speak a little bit about the relationship between noise exposure and tinnitus? And what do you think needs more attention in this area? Or do you see any new innovations arising from any of the recent research?
Yeah, great question. So tinnitus is something we've been actively evaluating as part of the Apple hearing study, and we're finding that it's much perhaps more common than we recognize. So we're finding a substantial fraction of our participants experience tinnitus at least occasionally, and a smaller but still substantial fraction experience it daily or even in an ongoing basis. As you're well aware, and certainly anyone with tinnitus this can be a potentially debilitating condition. It's very distracting. It's associated with depression. It's pretty strongly associated with hearing loss from noise exposure. So if you have high noise, you're not guaranteed to get tinnitus by any means. But if you have high noise and a noise-induced hearing loss, tinnitus is a common sort of additional health outcome that you might have. The great news about noise-induced tinnitus, of course, is if we keep your noise level low enough, we're ideally eliminating the risk or the potential for that disease. So this is another kind of strong motivating factor for controlling your noise to keep your hearing as good as it possibly can be and to minimize this risk of tinnitus. We're very excited in the Apple Hearing Study. We actually have a relatively newly developed app that allows our participants to evaluate their tinnitus. So historically, tinnitus has been essentially a completely self-reported condition where, a provider would ask a person, do you experience tinnitus? How bad is it? How distracting is it? How much is it impacting your life? Those are all very relevant questions, but now using this app, our participants are able to match the sound of the tinnitus they're hearing to a spectrum of different types of sounds because tinnitus does not sound the same to everyone. And we're also able to match the intensity. So now really for the first time in a publicly available setting, people can assess their own tinnitus and figure out how loud is it, what's the sort of spectral profile of it. And that's potentially information that might be useful to a healthcare provider in terms of providing supports and interventions. I know cognitive behavioral therapy is one approach that's commonly used to handle tinnitus. Since the condition is incurable as of today, hopefully that will change. Any information I think we can provide people with to help them manage that condition is hugely valuable.
Absolutely. Even if it helps to guide them to what kind of noise can help mask it. That's amazing. Um, and then let's talk specifically about noise exposure and hearing health. What does the research tell us about long-term exposure, even if it's moderate levels of noise, for the effects on hearing over time?
It's an excellent question. So when it comes to noise exposure, we're not new to this issue. We've been studying noise exposure in great detail for pushing 100 years now. And we've known hearing loss can result from especially high levels of workplace noise for probably 800 years. So we've had some time to develop some knowledge about this situation to the point where science has basically established what I would consider a safe limit for being exposed to sound. And this is a limit that was initially put forth by the Environmental Protection Agency here in the US all the way back in 1974. And it's been held up. It's currently the standard that's used by the World Health Organization today. So while this limit it may feel somewhat dated since it's 50 years old, much like me this year, it can also, it's basically stood the test of time. And so the idea here is if we keep people's average exposure under 70 decibels, which again is probably just a little bit louder than people are listening to this video, we prevent any risk of any measurable hearing loss, even in the most sensitive or susceptible person. So that's truly a safe limit. On the flip side, I think people are often under the impression, for instance, that for workplace noise, which I've studied extensively in my career, that workplaces are complying with the Occupational Safety and Health Administration, or OSHA's required exposure limit, which is 90 decibels, about as loud as a gas-powered lawnmower at 3 feet away. People think, well, that must be safe over an 8-hour period. In fact, someone who's exposed at that 90 decibel level for 8 hours a day for years and years on end, we're going to see about 1 out of 3 people with that exposure end up with a permanent essentially irreversible material hearing loss. And so one thing I would love the viewers of this video to walk away with is the understanding that that OSHA limit is not a safe limit. 1 out of 3 people experiencing a permanent irreversible health effect is far from acceptable. By contrast, if we think about something that might cause cancer that's in the air we breathe or the water we drink, typically we're not comfortable if more than 1 in a million people is getting sick or ill. Here we're talking about 1 out of 3. So recognizing that the OSHA limit is not protective of a substantial portion of the population, and recognizing actually that this EPA limit is much more protective, I think is really useful to know. So again, if folks walk away with nothing else from me from this interview, knowing that, gosh, my workplace feels noisy, but we're right at the OSHA limit, that's way too noisy.
With that being said, for people who do want to protect their hearing, whether at work or recreationally, what advice would you give based on the research you've been doing?
There's fortunately quite a number of things we can do to protect our hearing. The first, I think, is what you're helping people do right now, is just to understand that there is, in fact, a risk to our hearing from noise. I think my experience, my 25 years of research and practice in environmental health, has taught me that unfortunately in America, more so than other countries I've worked in, people just don't tend to appreciate the importance of hearing. It's almost an ignored or a disregarded sense. And that's so unfortunate because hearing loss is debilitating. It's associated with social and economic and personal and mental health impacts. And hearing loss from noise is completely preventable. So just getting people to acknowledge and understand, hey, noise is bad for me, just like air pollution is bad for me, or drinking contaminated water is bad. That's a huge first step. So I have to congratulate you on this series of videos. Once you come up with that degree of recognition, then there's actually a number of things we can do here. So limiting the amount of time you spend in high noise, sort of programming in quiet periods during your day to give your ears a chance to recover, being aware of your surroundings, maybe avoiding high noise areas where you can. Certainly things like you mentioned already, setting the volume limit on your smart device while you're listening to media can be great. Paying attention to your wearable, or downloading an app to measure the sound around you to make sure that it's not excessively loud. Certainly, there are devices we can wear that can be protective. So earmuffs and earplugs can be extremely effective at protecting against noise if you wear them correctly. And that might seem like a no-brainer, but not every earplug is easy to put in. And then another new exciting technological development is we're starting to see come into the market new earbuds, for instance, for listening to media that not only block out background sound sort of passively, but now are actively blocking out background sound. So these can serve as a sort of hearing protector in that they're blocking that background sound, still allow you to listen to your media. These things have transparency modes now, where if you're in a dangerous environment, a pedestrian walking outside, you can let those outside sounds in while still enjoying your music. But I think this idea that some of the devices that many of us are wearing, hours and hours a day can actually help us benefit by reducing our exposures. I think that's a huge development for the better. And now some of those devices can now be used as essentially a hearing aid, or to take part as a hearing test device. And so lots of technological options here. The other thing I will tell people that they can do is, once they recognize that high noise is an issue, which it absolutely is, they can inform others and they can reach out to their policymakers to let them know this is an issue, this is a priority. Unfortunately, this issue hasn't gotten much attention in the United States since probably the early 1980s, when lots of the federal agencies that were doing work in this area were defunded. So I think getting this issue back on the radar for our policymakers is going to make for a quieter and healthier America in the long term.
Absolutely. And so would you say that you've seen any kind of changes already in the public behavior or even awareness of the effects of noise exposure, or the conversation changing a bit especially in the United States?
I will say I have seen that. I'm sort of an optimistic person by nature, but I think not necessarily due to things that have happened here in the United States, but a lot of the research that's been coming out of Western Europe, especially, which has started to document not only is noise bad for our hearing, which we've known for quite a while, but the fact that it's also bad for our cardiovascular system. It's bad for our mental health. It's bad for school children and learning. It's maybe linked to things like diabetes and low birth weight babies. So all of these health effects that have been documented repeatedly in studies mostly elsewhere in the world, I think are trickling down to us here in the United States, where we haven't had such a a strong research environment. And I think that's starting to motivate people to get interested in noise. I think we have companies like Apple that are entering the research space. They're funding studies so we can start to understand, what are noise levels doing over time in the United States? Are they getting louder? Are they getting quieter? I think there's somewhat of a renewed focus on noise in the workplace where some of the worst exposures happen, and recognizing that that is a preventable, essentially cause of damage that's irreversible to people who suffer it. I think all of those things are encouraging to me, and that we are starting to get some more public awareness. Unfortunately, our policymakers are lagging behind, but I think as the public becomes more aware that there's no reason for us to live in such a noisy environment, and in fact, it's bad for us to do so, I'm hoping that can help motivate even greater change in the future.
Yeah, absolutely. We are seeing a little bit more of the conversation from the younger generation too, which we find encouraging at CHC. So I'm not sure if you can tell us and the viewers, but can you let us know if there's anything that's coming up next in your work, or what direction you would like to see the research for noise exposure go towards? Is there any pressing questions that you feel really need to be addressed at this time?
Yeah, it's a wonderful opportunity that we have here. So we're really digging in right now to look at the linkages more closely between noise exposure and cardiovascular issues. So we're continuing to explore hearing loss. We do have I will say, historically, a pretty good understanding of how noise in the workplace impacts hearing and how bad it can be for hearing. But believe it or not, there's actually very little research that's looked at just our day-to-day lives and how those exposures might actually impact our hearing loss, or also our hearts and other systems. And so, with this unique opportunity we have to look at people's exposure all day long, for instance, using the Apple Watch, we're now starting to be able to compare how much noise exposure do people get from their environment compared to how much they get from their headphones. So I can recall back as a child when the Sony Walkman first came out, there was quite a bit of alarm about the idea that kids especially, are going to be wandering around with headphones on all day listening to their Walkman and getting a hearing loss. Now, that wave of hearing loss didn't really appear in any measurable way. And perhaps that's not surprising, because the Sony Walkman, I had one, would run for about 60 minutes on a pair of batteries, and then you were done. But now we have devices that can run for 18 or 20 hours a day, so people can listen for much longer. And so I think there remains this concern that, potentially people are really harming their hearing with their hearing or listening behaviors. We've seen in an Apple study and some preliminary results that people tend to have much lower exposures from their headphones than they do from the ambient environment. So that's somewhat encouraging, I will say, but we need to follow that over time to make sure it's the case. We're also trying to identify what particular aspects of people or sort of factors about people's lives might put them more or less at risk of a hearing loss or tinnitus. We've started to see, for instance, that certain racial and ethnic groups, Black and Hispanic Americans, for instance, seem to have much higher noise exposures than do other racial and ethnic groups. And that raises questions as to, for instance, do these people live in communities where background noise levels are just much higher? That would suggest somewhat of an environmental justice issue, so that's concerning. These strong gradients we're seeing in terms of exposure by age group are also very interesting to us. As you say, it seems young people are perhaps a little more interested in their hearing than they have been in the past. And I would say that's a good thing, because their exposures are much greater than any other group. So trying to zoom in and figure out, how do we identify an individual person who might be at sort of the greatest risk of a hearing loss based on their behaviors, their age, other types of factors. Those are all things that we're very interested in exploring. People are still at great risk.
So finally, as you know, our mission at CHC, along with the International Noise Awareness Day, is to educate the public on noise-induced hearing loss and noise exposure. And so how can a hearing and communication center like CHC improve our outreach regarding hearing health and noise-induced hearing loss? Are there suggestions we can give to other centers that may not do as much outreach, but can at least get the message out there?
Yeah, I'm glad we share the same mission because hearing health is such an important thing, and I try to spread the word whenever I can. As a scientist and a professor, I get paid basically to publish papers in peer-reviewed journals, and those papers get read maybe by my mom and me. So it's not a huge readership.
You
So
too.
I very much applaud your efforts to reach out to the public. We're trying to do the same. And as an example, with the Apple Hearing Study, we've been putting out study updates that are very public oriented, that are not necessarily hugely groundbreaking scientific results, but are things that we think people might find interesting and might be conversation starters. So, for instance, just 2 months ago, we put an update out where we looked at an analysis of noise levels associated with the Super Bowl. And we've seen very consistently across the whole nation, noise levels go up for people during the Super Bowl event. And so, from a scientific perspective, no one's ever really shown that a single event could raise noise levels across the country. So that's kind of interesting. But my hope is, from a sort of lay member of the public perspective, maybe that gets noise into the conversation. And they're like, hey, I never really thought about noise before, and how my exposure might change over time. So I think coming up with these more bite-sized pieces of hearing health
Mhm.
advice or just hearing health tidbits, information. In my mind, that's a great way to sort of get the public's interest peaked in terms of sound and hearing. And then I think once we have that interest developed, then we can have a deeper conversation. So I would just encourage you and other centers to continue creating videos like this, to push them out to the public, to take every opportunity we possibly can to get this very under-recognized but very harmful exposure onto people's radars, basically.
We're so grateful for your time, and also for your contributions to hearing health. It is really a mission of CHC to be able to educate the public in general, regarding hearing loss and untreated hearing loss, as well as tinnitus and noise exposure. And so I really do appreciate you giving us your time today.
Thank you very much for the opportunity. I appreciate it.